Hi there. We are going to continue looking at the problem with persistent pain. This is a battle. It really is a battle, but hopefully you're going to find that you're going to learn some reasons behind your persistent pain that you probably are not fully aware of. And as you listen to it, you might start to see connections. And so we're going to delve into, is pain the author of your story? Persistent Pain Part 2. And as we look at these different factors, before we were looking at the physical factors that could be contributing to the pain and seeing why you might have areas that are not recuperating. You're not healing, you're not recovering, you're not getting back to your life as it were. And these two things, what I've talked about before and what we'll talk about today, these are still things that can happen in conjunction with each other. So you can still have the physical factors that are contributing to pain, but we're also going to be looking at emotional factors. And we're going to just touch base on emotions and pain because the reality is, you all, that the mind is where your brain is housed, and that same brain that can register signals from your peripheral nervous system. We talked about that before, also is a brain that is so awesome, but it also is involved with the emotional experiences that we have. So it would kind of make sense that there could be some overlap between physical factors, something that we're sensing out in our hand or shoulder and our brain, and the emotional factors. So we're going to be looking at this, and we're just going to touch base on a few of them. But emotions that are triggering for pain are anxiety, for example, fear. These are a few examples: anger, pessimism, and depression. So we're going to look at these here. See, the emotional triggers, though, are things that are very interesting because you can have, if you have an emotional trigger, you can have pain that can persist long past your injury. And again, we looked at some of the physical factors, but this is a component of the emotional experience with people sometimes, is that because of these triggers, their pain is not going away. And so it's very key for you to learn and understand what might be causing you to hold on to some of these symptoms and problems. And there's another part of this we'll talk about too as we go through this. But let's look a little bit at a few of these emotions. So we're looking at anxiety right now. Now, anxiety, just in a general statement here I'm going to make, it's really a perception that you're out of control. Okay? It's a perception that you are out of control. And the key is the perception portion of this. Okay. And so what people do when they're very anxious, I just find they ask a lot of questions. They're literally very fidgety. They're kind of hyper in a way, or you can tell that they take information and they ruminate over it. But then it's done in such a way that ruminating is they kind of keep going over and over and over it, but not in the sense of, let me try to understand this so I can get myself out of this problem. It's more feeding. I'm anxious. I don't know what's going on, and oh no, I'm in trouble. And so people like this, when they get on something like Dr. Google and they try to look for information to explain their symptoms, they end up feeding more into this anxiety problem, which is going to in turn increase their pain levels. And we're going to explain why. And so anxious people, you have to be very careful, what you say to them. But if they hear anything like degenerated or ruptured, or I'll see you in surgery for a few years because you are bone on bone, these can trigger anxiety issues with people. And some people are just more prone to this. Now, there's some chemical things that are going on, but some people are just more prone to having an anxious attitude. And again, they think they're out of control. And the fact of the matter is, they have way more control than they realize. Another type of emotion is fear. And fear can be anything from an economic fear, okay, fear of the unknown. You don't know how things are going to turn out. You can have a legitimate fear that you're not able to function at your job. You might lose your job if your injury is not recuperating fast enough. You might be at a risk of losing the ability to provide for your family. There's just different things that can create a challenge for people, and that fear, it feeds the pain levels in your body. And we're going to explain why and how and what's going on with that. But you can have very legitimate reasons for fear. Now, let me tell you, anxiety and fear can seem like the same thing. And they actually are not. Anxiety is a perception of something going wrong. Fear is a legitimate concern of a poor outcome. Okay, so these are different, but they can still feel like the same for many people. And that's when we're going to have to use a little bit more of our reasoning and thinking to understand what this is really all about. Fear can also spill into things like you don't want to move because it hurts. You're afraid that you're going to hurt yourself again, so you won't move. And you are afraid that you're going to have another failed treatment. And again, there are people who end up with having an injection done, and that doesn't work. And so they end up on different kinds of pain pills. Those don't work. And then they end up saying, okay, we're going to do this surgery. And the surgery, maybe at one, initially seems like it's helping. After a while, no help at all. And then after a while, they're afraid of trying anything that anybody's telling them to do because of all this fear of failed treatments. And this kind of fear is paralyzing, I guess you could say. But when it goes to the point of you are just afraid to move your body because it hurts, and I do understand that, because you don't know if you're going to hurt yourself. But the reality is that challenge is going to keep you from doing the very thing that you need to do to get better and to recover. And there are people who will say they're not going to move or do anything at all with movement until the pain is 100% gone. And that is the worst thing you can do. So we have to get past this fear emotion. Now, it's doing other things in the body as well, but we're going to come to that. And then anger. Anger is a very toxic emotion, and it actually kindles inflammation like no other emotion in the body. A person can be angry before they got injured or had their problem, or they might be angry because of the injury and the problem and how it's affecting their life. Okay, they can be angry at how they're being treated in a situation. They could be angry because of what's going on at home and they don't feel supported, or maybe they even feel supported prior to the situation that created the pain. But the problem with the anger is that, again, it's a very potent emotion. And the fact is that you cannot release pain until you release anger. And so that's how serious this really is. So the problem with these emotions is that these few that we've talked about, it changes your brain. And so when you're having the anxiety, when you're having fear, and when you're angry, your brain is releasing your stress hormones, your epinephrine, your cortisol, and your adrenaline. And these are hormones that are released in response to stressors and feeling threatened. And so the importance of understanding this is so that you can see that your connection between the emotional component, which technically you can control, and your pain levels, which you feel like you can't control, can actually begin to create a rift and create a change in your pain outcomes. If you can really get this understanding, you cannot afford to continue to nurse these sorts of emotions. Cortisol, just in and of itself, okay, they're finding it's a very critical link between trauma and chronic pain. So a person who has experienced trauma, now when we're talking about trauma, we're also looking at an emotional factor. An emotional factor due to abuse, be it from childhood or domestic, or I have unfortunately have had clients that I have seen and have been in clinics that they had an assault that had happened to them. And typically they're women. And it's interesting to watch how that affects them. And so what I found in studies is that the cortisol, what it does, it causes a hypersensitivity of those peripheral nerves we were talking about before. It makes them overly sensitive. And so you can have a high pain level, you can even have nerve pain, and you can never have had any kind of an injury just because of the cortisol. So that's why these emotions are not good for you to harbor, because the hormonal changes, the hormonal releases into your system are going to be prone to trigger these high levels of pain, because the nerves are being bathed into these hormones, and it's going to make them sense pain more readily. Okay, so it can be that yes, you may have had an injury, and you can have pain that is from that injury, but then that pain is not resolving, and because of the physical factors we talked about before, but could also be because of these emotional factors. But on the flip side of this, you can also have pain and there's never been an injury because of the release of all the hormones that are going into your bloodstream and permeate, and blood is everywhere. And I mentioned before, if you want pain-free tissues, you have to have healthy circulation, good, healthy circulation. Your circulation is your blood flow. The content of your blood is going to determine the quality of your tissues, and it's going to affect your pain levels. Whatever is in it is either going to nurture you to recover, or it's going to feed you into having a persistent problem with pain. So it's very interesting to understand that because of these emotional factors, your symptoms can be that they're not related to any injury at all, or they may have even started with the injury, but they persist because there is this chemical cocktail, I'll call it, in the system. So a person can get very much so locked into pain. One of my favorite authors said that the relation which exists between the mind and the body is very, very intimate. When one is affected, the other sympathizes. So it's very difficult to separate. And I will tell you, just in the years that I've done this and working with different patients, the ones who are having difficulty releasing pain, there is some underlying emotional factor going on. And so if that's what you're experiencing, then this is just your just a notice for you to start to address these sorts of issues. So, we can look at the pain, emotional triggers, we can look at the pain, physical triggers. And so, just like we talked about, well, what are some things for you to do physically? I'm just going to give you a few tips of things that you can do if you are dealing with emotional pain. Emotion pain that is connected to emotions. So you want to just as the simplest way to start nipping it in the bud, you want to drop those cortisol levels. And so what we were showing is that this is very much so related to your stress levels. Pain, emotion pain that is connected to emotions. So you want to just as the simplest, one of the easiest things to do is to do deep breathing. And I know it's like, oh, we're going to do breaths and deep breathing. You inhale through your nose, you go and blow out through your lips. Okay. What this does is it starts to create a change, and it turns off your sympathetic nervous system, which is what releases all the cortisol and the epinephrine, and it turns on your parasympathetic nervous system. And so what they're finding, this is from the University of Toledo, that when you do deep breathing and you're breathing from your diaphragm, not up here in your throat, but from your diaphragm, that this is going to send a signal to your brain to tell the anxious part of the brain that you're safe and you don't need to fight, you don't need to flee, and you don't have to freeze and panic. Deep breathing gets more into the oxygen to the thinking brain. And the thinking brain is something we're going to talk about briefly. But first of all, the breathing properly is your first steps, because when you breathe properly, It's going to help you to get your ability to focus, and then your brain waves start to change. So, like I said, we did all these chemicals released into the body, brain wave change. We want to flip that. Okay, so we're going to change the brain waves by breathing deeply. And the longer you practice it, 15 minutes at a time, then your brain wave patterns are going to change. Your sense of pain is going to drop, and you're going to start to become calmer. And then your brain is not going to go into panic mode. Now, this whole panic mode, we'll have to talk about, but the part of the brain that is critical for you to get in control of, and we said the deep breathing brought oxygen to the front part of the brain, because that is where your prefrontal cortex is. That's your decision making portion of your brain. That's where you use your will, you use your rational thinking to make decisions about, even, let's say I'm telling you that you need to move, and you're feeling like, well, if I reach over, my arm's going to, pop, and I'm not going to be able to do that move without, causing serious damage. And all you're doing is reaching over, to pick up a piece of paper. We're not telling you to go reach and pick up a 50-pound kettlebell. Okay. So you have to use your thinking to do movements, to make decisions that are more reasonable and rational. That's going to be in the front part of the brain. And again, breathing improves that. But it also, when you start using your prefrontal cortex, it's going to override your limbic system, which is your emotional center, which is where all of this fear and this anger and all the anxiety is coming from. Now, something else which might seem a little bit different is there was a study done in Britain, and they were finding that if you ate certain kinds of foods, that will trigger happy hormones. So if we have these negative hormones we want to turn off, just like the sympathetic nervous system we want to turn off, we want to turn on the opposite, which is going to be turn on those hormones that are the happy hormones. And they found that if a person ate foods like leafy greens, which are rich in B vitamins, strawberries, avocados, nuts and seeds, vanilla beans, even smelling it. Okay, all of these things create tryptophan, which is part of the building block for you to release serotonin, which is your happy hormone. And they were finding that a person, if they ate, fruits and vegetables, 7 to 8 portions of those in a day, they had a happier mood. Also, being able to eat vitamin A rich foods, your carrots and your oranges and your vitamin C and your vitamin E foods, reduce your inflammation in your body, which contribute to less depression. So even how you're eating is very, very critical if you want to conquer pain naturally. We've already talked about exercise, and so I've already told you that movement and exercise, it's very much so a critical part if you want to conquer your pain. It's been proven to help you to overcome persistent pain. And again, I want you to look to embrace motion as medicine. You can't go wrong, you all, if you take on some of these strategies. So if you're really looking at reducing your pain levels, and you're seeing from just listening to what we were saying so far today that you might have some emotional factors that are contributing, some of the immediate things you can do is breathing properly, in through the nose, out through the lips. I tell patients, smell the roses and blow out the candle. Okay, go throw out the candles. Think about your birthday cake. And if you look at doing that, if you look at eating foods that can help with your tryptophan production in your brain, and if you just start looking at getting moving, gently stretching, walking. And I will tell you, get out in nature. Nature, where you have trees or water, especially the ocean, has negative ions. And when you're out in that fresh air, you're getting oxygenation, which again is going to help the brain to calm down, but it also helps with the tissues and gets nourishment of oxygen into your tissues. So I hope that you have gained some understanding of what could be possibly something that you're dealing with that could be triggering some of this persistent pain pattern. And again, if you have a question and you want a little more guidance, go to my website, restored-healthsolutions.com. And on there, you can sign up for a 15-minute free consultation. And I will be glad to speak with you. And if there's any ways that I can guide you into some of the things that will be starting you on your journey. Thank you. I hope you found this helpful.